Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting 127 new cases of COVID-19 in Windsor and Essex County. 16 cases are related to outbreaks, 3 are close contacts of confirmed cases, 2 are community acquired, and 106 are still under investigation. We have had 5,861 cases since March, 4,622 cases are now resolved, and 1,141 cases are active and being followed by our health unit. 83 confirmed cases are currently in the hospital and 13 people are in ICU. In Windsor hospitals, there are 118 suspected cases of COVID-19. We are reporting our community has lost 98 people to COVID. 61 deaths have occurred among residents in long-term care and retirement homes. There are currently 35 active outbreaks in Windsor and Essex County. 13 in long-term care and retirement homes. 14 workplaces are in outbreak. 8 in the agriculture sector, 2 in healthcare/social assistance sector, 1 in finance and insurance, and 3 in manufacturing. 2 schools are in outbreak and 3 community outbreaks are currently ongoing. And in addition, we have 3 hospital outbreaks, 2 at Met campus, Windsor Regional Hospital, and Hotel Dieu Grace Hospital Healthcare. Please do your part to prevent the spread of COVID-19. Stay home if you are sick. Limit your close contacts to your household. Keep a 2-meter distance from others. Wash your hands often with soap and water, or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering indoors. Outdoors, if physical distancing cannot be maintained, or if wearing a mask is required. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. And download the COVID exposure app at canada.ca. Testing for COVID is available by appointment at selected pharmacies and assessment centers. Please call in advance to book your appointment and determine your eligibility. Windsor-Essex has 3 testing and assessment centers: Windsor Regional Hospital Olette Campus, Windsor Regional Hospital Met Campus, and Erie Shores Healthcare in Leamington. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at wechu.org for further information and updates. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. Let me start the day by saying that vaccines are on the way. We got the confirmation on Friday from the province that Windsor Regional Hospital will be one of the sites to receive Pfizer-BioNTech vaccine. We will receive a limited supply of these vaccines that will be directed to employees who work at long-term care retirement home that are not in COVID outbreak. A proportion of these employees from these homes will be vaccinated in the initial cycle. Once we finish the initial cycle, and depending on the supply, we will target the facilities that come out of the outbreak at that time, followed by the facilities with contained COVID outbreak. We hope to have more steady supply of vaccines in the coming weeks to vaccinate all residents and staff working in these facilities, including healthcare workers that are working in high-risk areas such as COVID assessment centers, ICU, and floors with COVID-19 patients, and other priority groups identified by the Government of Ontario. Now about the vaccines, some of you might wonder, what are these vaccines? Vaccines are a way to prevent certain serious diseases or deadly infections. Vaccine works by causing your body to make antibodies against a specific bacteria or a virus, like it would if you had an infection. This helps to prepare your immune system to fight off germs if you come in contact with the same bacteria or virus in the future. It was due to the widespread use of these vaccines that we no longer see many deadly diseases in the world, for example, measles, meningitis, smallpox, and many others. How does vaccine work, or specifically COVID-19 vaccine work? Pfizer-BioNTech vaccines are a type of vaccine that are called an mRNA vaccine. An mRNA vaccine refers to the genetic material from SARS-CoV-2 virus that causes the COVID-19 disease. The The vaccine uses the same genetic material to give instructions to the body to make a specific type of protein that is normally found in the SARS-CoV-2 virus. By doing that, the body never really have to see the actual virus, but able to create antibodies as a response to these proteins. These antibodies can then immediately attack the actual virus if and when it attacks the immunized individual and prevent any infection. The initial studies using these mRNA vaccines found that they work extremely well with up to 95% effectiveness. It is important to know that these COVID-19 vaccines do not contain the actual virus, so they cannot give you the infection. They also do not cause your body to make the live virus. The vaccine requires 2 doses given few weeks apart, depending on the type of vaccine that you are getting. It is important to get both these doses for the vaccines to be the most effective. Some of you are wondering if there are any side effects associated with the COVID-19 vaccine. It can. Side effects with this vaccine is similar to any other vaccine. It includes pain at the site of injection, body chills, feeling tired, and feeling feverish. These are all common side effects and do not pose a risk to health. As with all vaccine, there's a chance that there will be a serious side effect, but these are very rare. A serious side effect might be something like an allergic reaction. Speak with your healthcare professional about any serious allergies or any other health conditions you may have before you receive this vaccine. Another question that you might be wondering that if you still need the vaccine if you had previously suffered from COVID-19. Based on the expert recommendation, you should still get vaccinated if you had the COVID-19 in the past. People who get COVID-19 do develop antibodies, but it is not known exactly how long antibodies last after a person recovers. Even if you get the vaccine, you still have to use the facial covering, follow physical distancing measures, and it will take some time to learn exactly how long immunity lasts and how many people are vaccinated and how this is affecting the spread of COVID-19 in the community. Until then, we still have to continue to follow all these measures that we are currently following. Thank you.
We'll now take questions from the media. Today we'll start with AM 800.
Dr. Ahmed, for the vaccine, will you and your team be receiving it?
The Pfizer-BioNTech vaccine, the site would be Windsor Regional Hospital, and they are the one who are involved in bulk of the planning. We are working closely with them with respect to the public health side of the things, including the prioritization and identifying the target group, and the actual logistics of the vaccine is maintained by the Windsor Regional Hospital.
But I guess, sorry, maybe I worded it wrong. Self and your team, will you be getting the vaccine?
No, not our team will be getting the vaccine. The vaccines right now is targeted to the healthcare workers and including personal support workers working in the long-term care home and retirement home. Obviously, we not all of us work directly with patients or with seniors in these vulnerable settings. So we obviously we are not in the priority group.
Okay, and then the numbers that we're seeing, and I know I asked you this question, I believe last week or the week before, but the numbers that we're seeing, would you put those towards the gray zone, or are we still in the red zone?
Well, the red zone criteria, it goes all the way up to 40 cases per 100,000 population in a week time. We are still way past that number, and it will take us at least a few more weeks to come even close to that number if we start to see cases trending down. We are still reporting close to 100, 150 cases, 170 cases we report a few days ago. So it's still a significant transmission that we are seeing in the community, and unless we start to see cases that were before when we went to orange or red criteria, I think that would be the case count that we will be looking at. Right now, I don't think that based on what we have. We need to think anything different or convey any different message. The risk continues to be really high in our community, and we still need to have all these measures and more to protect our residents from contracting and developing any severe complications. We're already reporting many deaths in the last few days, and it is concerning because, as we have said, that death is a lagging indicator, and even in the next few days or in a week or two, we will continue to expect more deaths in our community.
And finally, this 127 cases today, do you think these individuals got the virus while we were in the red zone, or did it happen last week?
I would say that whatever we are seeing right now, it cannot be more than 7 days from that day that they were tested. So it would be something that we have seen or we are seeing is a result of us being in a gray zone or early part of gray zone.
Thank you.
Any questions from CTV?
Yes, good morning, Doctor. Good morning, Teresa. I'm just curious, first of all, how many doses are available to the area right now?
So that's the number that we don't have a confirmation from the province,
Okay.
and obviously they are controlling that number.
Okay, so I'm just curious, like, will the media be able to be in the area to take shots of the first people that get inoculated?
Well, there will be enough to vaccinate a significant number of healthcare workers working in the long-term care home and retirement home, and that's the target. We can speak more freely once we actually get those confirmation and numbers from the ministry.
Okay, different topic here. Just curious, in terms of enforcement, where are we at with that? Our officers are out, and if they are, what is the focus right now?
I'll pass it on to Teresa.
I can give an update that, so we track all of the charges in the past week. And so last week, our tobacco and vaping enforcement officers charged 2 retail establishments, so for a total of 21 since the beginning of November. So I don't know about any other charges outside of what the health unit has actually done with our internal enforcement officers.
All right, well, I guess the curiosity question here is that I know there's a lot of talk about perhaps a lockdown on Christmas Eve. So if that's the case, and I guess we're speculating on this one right now, but will officers be out checking households to ensure residents are staying within the rules during that holiday period?
Well, our officers don't actually go into residents or personal homes. They are in the community in retail and restaurants and hospitality, personal care settings. That's primarily where our officers are, focusing their energies on. But
So I guess the focus will be more on Boxing Day, the next day after Christmas then, right? For your guys and gals?
well, they would be, that would be more of under their, enforcement duties.
Okay. All right, cool. Thank you.
Any questions from CBC?
Hi, yes, good morning. I just wanted to ask more about the vaccine, and do we have a sense of when the first vaccines are going to be administered? Could it be this week? Do we have a date at all?
I can't speak on the date, but I'm quite confident that it would be this week. So stay tuned for further updates.
Okay, we're also hearing about a new strain of the virus locally that's more contagious, and I'm just wondering what you can tell us about that. What are you seeing?
So I think we have seen some news coming from England right now about a new strain that's more spread very quickly, and some concerns raised there, leading many countries to close their borders temporarily from all flights coming in from UK. Locally, I don't think that we have any evidence, but that doesn't mean that it doesn't exist. But we haven't seen anything that was raised to us by the provincial lab or the national lab. Usually these type of more detailed analysis are done by the provincial or national lab. So I can't really tell what the concern is locally at this time unless we hear more from the provincial or national lab.
Okay, and then I also want to ask about the measures that we might be hearing today or expecting today from the province in terms of a stricter lockdown enforcement. And I know that you made your recommendations to the province. If the province doesn't make recommendations that are strong enough, can we expect from the health unit more restrictions locally on your own, the way we've seen before?
Well, I think what our cases that we are seeing is absolutely very puts us at a very high risk of further transmission. And if some of these measures are not put in place, we can expect to see things getting worse during the Christmas holidays. So we definitely want to see a stricter recommendations and stricter measures put forward by the province. But we'll have to wait and see what recommendations come forward. As I said, locally, we do have significant concerns with the community transmission, with the cases that we are seeing and the pressures on the healthcare system. So we'll have to wait and see what happens from the province, and if needed, if there's anything more that we can do to further strengthen it, we will. And right now, it's just a waiting game for us.
Okay, thank you.
Any questions from Blackburn?
Yes, just further to that, I guess we're already in lockdown. It's already illegal, quotes, to go and gather with anybody outside of your household. Non-essential businesses are closed. What further restrictions are you looking for?
Well, I think when we're talking about the businesses, what businesses are closed versus what businesses are open this time, and I'll recall, or I'll maybe point out to the fact, before stage 1 was introduced into the province, right at the initial phase of the pandemic, there was more widespread closure, which basically forced people to stay at home. And then when people stayed at home, we were able to flatten the curve. We didn't see the impact that we are seeing right now. So even though when we are saying that it's a lockdown, but practically everything is open in one form or the other, except for some businesses that are now impacted by the gray lockdown measures. But with respect to the overall picture, everything is pretty much ongoing. People are still going and to work, or people are congregating, people are having all these social gatherings and all those messages. So I think we just want to be clear in terms of the messaging part, that what exactly are we dealing with. And it just surprises me every day when we are still getting some of the same concerns when people are being contacted about their results. Sometimes they're not even at home, and which really surprises me that they are given instructions even while you're waiting for a test result. You should stay home, because there's a strong possibility that you will be positive because you are symptomatic, you are identified as a close contact. Unless you get the results back, you should stay home. But people are out. People are still having those mini parties and always thinking that, oh, my group is safe and everyone else is not safe. So I think that there's clearly some disconnect in terms of what the message is. And when we are calling something a lockdown, it better be a lockdown. That means people are forced to stay home to protect lives, to save lives everywhere. And that's what we are struggling. It's not a great feeling to sit in front here and report all these deaths that we're seeing in the community as a result of people not following those measures. Because many people who contract COVID, maybe they can survive, but if they infect others who are vulnerable, they will not survive. So I think we want to make sure that when we're talking about lockdown, it is a lockdown, and people are taking those measures seriously. It is enforced seriously, and anything that doesn't need to stay open, they should close.
And finally, as of Christmas Day, kids will have been out of school for 2 weeks. Do you think that will give people a false sense of security that maybe they've isolated for 2 weeks, don't have symptoms, and they can gather with their family because nobody's been out of the house for 2 weeks?
Well, I think at this point with the cases that we are seeing right now, first of all, I'll go back to the gray lockdown measures. Under the gray lockdown measures, it is not allowed to have any gathering with anyone who you do not live with, period. So that's basically just what the guidelines are. So anyone, if they're having those meetings, they will be in violation of the Reopening Ontario Act under the gray lockdown measures. So that's the first thing. Second thing is, I think from a sense of security versus a false sense of security, it is something that we have always said. With the amount of cases that we have in the community, you never know who you're meeting and who else they are meeting. So even though you're thinking that your bubble is, or whatever you want to call it, it's limited to 2 or 3 people or maybe 5 people or whatever. But in reality, each one of them may have other people. So your bubble could be as big as 50. And people are still thinking that their bubble is very small, like 5. So people need to understand that whatever they're doing, anyone and everyone, and this is how I would always advise everyone, anyone who doesn't live with you could be a potential case of COVID. What do I need to do to protect myself and my family? I would do everything that's recommended, irrespective of the fact that how well I know that person or how well this person is talking about himself or herself with their symptoms or what they're doing. I would not want to take all these measures lightly, and will use everything to make sure that I am keeping myself safe and I'm keeping everyone around me safe.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, doctor. Can you talk more about the rationale behind vaccinating the long-term care home staff and how that will keep the residents who are apparently a more vulnerable population safe?
Good question, Taylor. So one of the things that, especially with the early doses of Pfizer-BioNTech vaccine, is their mobility issue. You can only move the vaccine up to a certain number of times. So by the time when the vaccine will come into the freezers of these hospitals, they cannot go further. So we'll have to make sure that anyone who needs the vaccine can and should come to that site. The challenge with these long-term care home and retirement home residents, their mobility. You cannot bring them to the vaccination site, and hence they cannot get vaccine in that manner. And because that all of these people are, in theory, are not leaving their facility. So the only way to introduce the infection in this facility is through the healthcare worker. So a healthcare worker who is providing care, a direct care, if they are protected, if they are not developing the disease, then they cannot pass it on to any of the residents. And that way, so we are basically just putting protection around these seniors and vulnerable people in these homes by vaccinating the healthcare workers. And that's the same idea when we are talking about healthcare workers in other settings. When we are vaccinating the healthcare workers, is basically their ability to transmit this virus to other people if they contract or if they come across with one person and then passing it on to another.
And as far as you know, does the vaccine, the Pfizer vaccine, prevent somebody who's immunized from getting COVID-19 outright, or could they still get COVID with more mild symptoms as we sometimes see with the flu vaccine?
So I think at this time, what we are, again, the data, we're still looking at all the data, and we cannot say whether it will prevent the infection in the first place or not, and how it will do that. But what we know from the data that we have is anyone who has vaccinated, their symptoms will be really mild. It will prevent all these hospitalization, and it should, in theory, also protect and prevent any further transmission from that person. But again, a lot of these data is still in the early phase to make anything definitive, but based on how vaccine work, we definitely anticipate that all of those things will happen. People shouldn't get the disease at all. The people shouldn't be able to transmit this disease at all. And then overall, from the mortality and morbidity perspective, all those data will go down. But based on the limited evidence, we do know that it's effective for presenting any severe symptoms and any further transmission.
And then finally, have you had conversations about us receiving doses for the general population? Is that widespread rollout still many months away?
Well, the way the national strategy gives us a stage 1 and a stage 2 deployment of these vaccines. So under stage 1, we are obviously in a stage 1 with limited supply. There's very specific target group that's being identified in that category. And then once we finish this category, which includes all these healthcare workers, long-term care home residents, and staff, once we get through that part, and then the second set of all the essential workers, all the other remaining healthcare workers who are not necessarily taking care of all these people, the seniors in our community older than 70 years and older, those will be the priority in stage 2. And then the rest would be under stage 3 with more widespread mass vaccination available for anyone and everyone. That would come in stage 3. Right now we're in stage 1, and that's what the focus is. We're hoping once we know more about the flow and distribution of these vaccines, we'll have a much better idea about the timing of it. And based on our understanding, there's a lot of work that's being done, and by early spring, we should expect to see us to move into somewhat of stage 3 with vaccines available for the general public.
Okay, thank you.
Any further questions from AM 800?
Dr. Ahmed, I know the city is discussing this later today at their council meeting, but over the weekend, a release was sent out by the city talking about the reopening of the outdoor rink at Lansbury Park. Is that allowed under the gray lockdown status?
Well, I think when you're looking at what is allowed versus what is not allowed, there are certain provisions, and again, some of that is legal interpretation, that how you're reading the law and how you're implementing it. It may fit that into the legal domain, but from a public health recommendation perspective, it is not okay to have that many people, or even giving people any reason to come together. So I think that's the concern from a public health side, and I'm hoping that the council will make the right decision and reconsider their plans to open this park.
Because as of now, like it states in the release, the park is reopening. Like I said, council's talking about it at 1 o'clock today, but they can they're allowing up to 25 skaters on the ice, no mask. They have to wear a mask prior to going on the ice. So what's the difference? And it kind of goes back to Maureen's question about families getting together for Christmas. If I wanted to invite 24 family members to meet me at the rink, what's the difference with me meeting with them at the rink, or just the general public, anyone could meet them at the rink compared to meeting at a household?
Well, I think, even in the gray lockdown zone, there are a maximum of 10 people that can come together. And again, not that I'm asking them to reduce that number to 10, but I think overall, any opportunities, especially where we are in the community, for people to get together, that should be discouraged. And there is still a difference when we are talking about when you're inviting someone inside your home versus these type of event where they are complete strangers that you are interacting with, because you're with strangers, you are not coming close to within the 2 meters distance, and also your ability to wear the mask, whether you're wearing it or whether you're not. So I think there is a slight difference, but don't get me wrong here. I think from public health side, we definitely don't want to say that these type of events are okay, and I really hope that the city will reconsider their decision and cancel their plans.
Sorry, one more on this one. Was the health unit asked for their opinion before the city made their decision?
Well, because it doesn't involve anything that touches with public health, so public health was not involved in this decision making.
Okay, thank you.
Any further questions from CTV?
So doctor, if they don't rescind, will you go knock on their door and get involved and try to shut that down?
Well,
I know it's your recommendation that they don't.
well, we'll have to look into it and I guess really try to figure out a best way to address it. At this time, I can't say what will happen.
Okay. And just a curiosity question too, is that a single shot dose or a double shot with this Pfizer vaccine?
So it's a 2-dose schedule. So far, all the vaccines.
2 doses, okay.
Yeah, it's all 2 doses.
Okay, just wanted to make sure. Thank you.
Okay.
Any further questions from CBC?
Yeah, I just wanted to ask you again about Christmas. There's obviously a lot of fear about what might happen in the weeks that follow Christmas if people don't follow regulations. And I just wanted to ask you to summarize for the public again, sort of what is your biggest fear if people don't do what they're supposed to do this Christmas?
Well, I think when people are meeting, first of all, they will be in violation of the Reopening Ontario Act. And I think I just want to make sure that people understand that very clearly. So this is not allowed under the Reopening Ontario Act at this time. People who live alone, they can get together with another family. But for everyone else, try and celebrate your holidays with your immediate family members. That's it. And anyone who would be having these meetings, in addition to violating what is allowed and what's not allowed, they will also be putting themselves at risk. They will be putting their families at risk because with this widespread transmission, there is a strong possibility that any of a single person, if they are part of that gathering, they can potentially infect everyone. And if any of them have another family member who was a senior or a mother, a grandmother, a grandfather, or grandparents, any of them, if they are there, they can have much more severe consequences compared to anyone who are at the younger age group. And the transmission continues. So I think I would just want to make sure that people understand the risk, what is at stake, and make the right choice by following these recommendations.
Thank you so much.
Any further questions from Blackburn?
No, thank you.
Any further questions from the Windsor Star?
Yeah, doctor, I guess, how are you feeling that the vaccine is finally arriving here, even in a preliminary rollout?
Yeah, no, I think it's, we were waiting for the vaccine for a long time, and finally it's arriving. So it's all looks that it's coming together. So we can see some light at the end of the tunnel, but again, the tunnel is very long. We still have to be patient with all these vaccines that are coming in with ample supply and distribution to get into the hands of the people. And it will take a few months, but at least it's the start. And once we start vaccinating more and more people, we should expect to see better results, better control in the community, and returning back to normalcy. I think everyone wants that. We have heard loud and clear from everyone, the residents, the businesses. Everyone is having a very difficult time at this time of the year and throughout 2020 and maybe early parts of 2021. So we definitely like to get to a place where we can start to return to some kind of normalcy. So we're really excited, and we hope that the supplies continues to come to Windsor, and we continue to vaccinate people as quickly as possible.
Okay, thank you.
Thank you, everyone.